Hi, everyone. Welcome back to another episode of the JPN Medical Halacha. Today, we'll be discussing principles of medical care on Shabbos. And what that is supposed to do is just try to approach more in life and practical cases and how we would go through it based on concepts we've learned and are going to continue learning in this particular lecture.
Yeah, and as always, my name is Mendel Jacobs, MS2 at CD Downstate, and my partner today is
Mark. Mark Gans, also on MS2 at Downstate, and yeah.
And the topic of this week is going to be kind of probably the most practical side of this Shabbos series, because this is far from just going to be about a resident in the hospital. This is also really going to cover a big chunk of civilian medicine, so to speak. We're all going to be community members, and people are invariably going to come up on Shabbos and ask us questions, and family members are also going to need some of this stuff. And this really is going to be the theme of today's little chat, is going to be about the treatment of non-critically ill patients on Shabbos. So this is gonna, we're gonna go through a few clinical examples, but this is gonna be a little bit of a departure from a lot of the topics we were speaking at previously, where, we're talking about inpatient hospital patients who generally have some form of a life-threatening issue. All right, and as always, this is for edutainment only. We really hope that what this does is give people a good foundation in approaching some of these halachic issues, but they're not meant to be a replacement for rabbinic advice, nor are they supposed to be a replacement in any way, shape, or form for any medical advice. Before we start, it might be convenient to talk about the legal philosophy of Chazal, as we're going to see a big portion of this of this little chat is going to be about how many Isurim Derabanan are going to be allowed in the cases that we're going to delineate. And so it's handy to figure out what is an Isur Derabanan. And when we say an Isur Derabanan, something that's rabbinically prohibited, which rabbis specifically are we speaking about? And so generally, rabbinic enactments that you'll find in Gemara and that are binding for all Jews, they were generally done in a, kind of the generation before the Tanaic literature was begun. A lot of this happened in the time of the second Beis Hamikdash and by Sheni, which really covered the years, the active years of 200 BCE to about the year 200 Common Era. A lot of this is not going to be well delineated in any of the rabbinic literature that follows. It doesn't, the timing of it wasn't as important. Some timing of some xeris will become apparent, but most of it isn't. And it's really not that useful to figure out exactly when each gezerah was enacted. The legal philosophy of Chazal was a bit of a departure from the biblical, the general legal philosophy of Isur D'Oraisa, things that are biblically prohibited. Biblical prohibitions in general tell you what the bottom threshold for allowed or not allowed is. So in our conversation about Shabbos, what constitutes work on Shabbos may be very different than your average English, assumption of what work is. Work, on the other hand, from a rabbinic point of view, does sound much more human, much more relatable. And the purpose of that was that the Chachamim recognized that you could keep a biblical Shabbos, but really lose the spirit of Shabbos. And as you'll see, is a general philosophy of Chazal was, we're going to make rabbinic enactments that make sure that we can keep the people as close to the spirit of the law, not just the letter of the law. And as we're going to see, that in certain cases, the spirit of the law is a bit of a luxury. So for example, if a patient's really not feeling well, the spirit of the law of Shabbos is not, resting and having a spiritual experience is not really possible because the patient's in severe pain. So in those cases, the Chachamim didn't make a gzera. They didn't make a rabbinic enactment. So as we're going to see, it's not like we're superseding the Chachamim's advice. What we're doing is we're recognizing cases where things are just allowed because the Chachamim never made a gzera. The way you're going to see it in some of the Rishonim, some of the original sources, is b'makim chayli lo gazru rabbanan. In a place of pain, the Chacham didn't make an enactment. That's just a brief introduction to kind of the psychology of a lot of the later sources that we're going to read.
So just to briefly nail down exactly what we're saying is that because they were enacted in circumstances, and because those circumstances are not really applicable when someone is a certain type of sick, that's how we're going to kind of navigate going through, like being able to sort of transgress those rabbinic prohibitions, because it's not a real transgression. They were specifically there under certain circumstances, and being sick kind of removes those circumstances. Is that?
Yeah, that's a good way of saying it. Or just to phrase it again, just a little bit differently. There are certain cases where the Chachamim never made exer to begin with. They never gave you rabbinic advice. They never gave you legal jurisprudence in some areas. For example, someone who's fallen very ill does not need a fast on their rabbinic fasts. It's not that he's transgressing the fast by eating. The fast was never meant for him. And that's kind of the same thing by Shabbos. There are certain things where there's exer d'Rabbanan. The exer d'Rabbanan was never intended to be applied to a case where someone was ill. Now, exactly what type of illness are we talking about? So we preface by saying this is a non-critically ill patient. Now, there are many different types of non-critically ill patients. You could have a cough. You could have something much more benign. The type of chaylish ein b'sakana that really makes it into the halachic literature is a specific type of patient, as a patient who is under so much pain that they're bedridden. The way the Shulchan Aruch writes it, and again, this is just to define the terms of what a chaylish ein b'sakana is. It's a chaylish nafal machmas chalil mishkav, someone who's in such pain that they had to go to bed. They had to put their head down for a little while. In other words, they can't really function. So a slight cough, you can still function. You can still get by your day. A severe cough or a severe migraine is going to be very different than a slight headache. Slight headache, you can't be mevater on d'Rabbanan, but on a severe migraine that makes you bedridden, the Chachamim never meant to impose any added restrictions to you. So here's some practical examples. So Shulchan Aruch says something that makes you bedridden. Rav Newbort in his Sefer Shema Shabbos Kehilsa, which really is the authoritative document when it comes to a lot of this medical stuff, especially for the lay people. So 99% of cases that will happen, just in the day-to-day life, especially on Shabbos, they're going to be in this Sefer. It's written under the direct supervision of Rav Shlomo Zalman Auerbach, who was one of the biggest, if not arguably the biggest, Pesach in terms of medical halacha of the last century. So he writes a few examples. Migraine, like we said before, asthma, where a person's really out of breath, they can't really function. Again, we're assuming this is not life-threatening, but severe discomfort. Diabetics, whether they're very high or very low, beyond it being potentially life-threatening. In cases where it's not life-threatening, they're allowed to do a surgery d'Rabbanan, as we're going to see. And children in general, though the children we're going to try to address in a full conversation for itself. All right, so we're just going to work through some vignettes. And the purpose of this is not to paskin or to, we don't have the tools really yet to figure out these cases. But as we're going to see in a lot of Hilchos Shabbos, when practical cases come up, it's really handy to figure out how to break down a case to its constituent parts. What we're going to try to do is we're going to go through a couple of vignettes and figure out what isurim are actually involved. And we're going to try to figure out if these isurim that are involved are of biblical nature or of rabbinic nature. That's going to be very relevant, as we said before, because we have indulgences kind of in the era of rabbinic prohibition. We don't have any indulgences in terms of biblical prohibition. Mark?
Yeah, so the point of this would really be, so let me frame it a little bit. Our entire conversation is, we mentioned in a previous lecture, we have different types of sick people. We have chol sheish bo sakana, chol she'ein bo sakana, and a few other categories. And what we're trying to address is specifically chol she'ein bo sakana. So we're specifically talking about patients who are not in danger, like we've discussed in other lectures. And with that knowledge, we know certain things can be done, certain things cannot be done because their life is not in danger. And so we have to identify what it is that we're trying to get done and whether or not derais d'Rabbanan, like how that lines up with us caring for them. So, right, that's, and then based on what we identify in these cases, we'll further follow through with, if it is d'Rabbanan, how do we navigate that because they're sick? And so we're going to revisit these cases once we discuss all the differences in d'Rabbanan and d'Oraisa. Is that right?
Yeah, so we're just going to try to break down these cases to its constituent parts, figure out what the halachic questions are in these cases, and then we're going to figure out how do we resolve these questions later after we kind of go through the basic material.
Okay, great. So let's I'll take a look at these. And again, in general, my role is usually that I'm not as prepared, and I'm looking at this so I can sort of be the liaison for anyone watching this for the first time and doesn't have as much Shabbos and halachic background as Menachem does. So I'm gonna try to take a crack at it. So let's see. But before this, I would just say, in general, when you approach a problem, generally it's smart and a good idea to look at what is the status of the patient in terms of, are they chol sheish bo sakana or she'ein bo sakana? Whereas we already sort of know based on our conversation, these are all patients who are not particularly in danger. But before you would even look at a case, you would generally assume that role is what you're looking for. Is the patient in danger, and how much leeway do we have? So with that said, let's take a look. A community member has a migraine and needs medication. There's no Erev. You go across town to get some from your medical bag and carry it back to the patient. What isurim are involved? Okay, so let's look at this. Community has a migraine and needs medication. There's no Erev. Okay, so if there's no Erev, then you start to run into issue with carrying. So little disclaimer, I have seen some of this before, just in helping preparation for this lecture. But when I originally heard this, I know there are components of carrying that are deraisa, and there are components of carrying that are not deraisa. So I think it would be important to clarify exactly, if you're going like across town, that can actually change. So there's that one part is that carrying can be an isser, and it could be deraisa derabanan depending. There's also the issue of, let's see, you're carrying. There's also the issue of tchum. So it also depends on how much you're walking. I think if you're just going to get your medical bag and it's not too far from your house, that may or may not be an issue, but it should be probably something that has to be discussed. And carrying it back to the patient is the same issue that we originally had, which is carrying, which again can be deraisa derabanan depending on what the situation is. If we're talking about Rishis Rab and Rishis Yachid. But I can say that when I first saw this case, I definitely thought it was impossible. There was no way that you'd be allowed to go across town, get your stuff, and carry back. So those are my thoughts on the first case. Did I miss anything? Any isurim that may have to be addressed?
No, I think this case is pretty straightforward. This is really, like you said, going to be either an issue of Tchum Shabbos, but in this case, highly unlikely because you're going across town. So Tchum probably doesn't exist. It's not going to be an issue of Tchum. But the no Erev, your assumption is correct. Is this a case of a deraisa case of carrying, which is specifically taken from Rishis Rabban to Rishis Yachid? Rishis Rabban has specific legal ramifications of what is a Rishis Rabban. And yeah, that would be our issue. So looking at it, the layperson might assume that this is an issue deraisa. As we're, just I guess, spoiler, all carrying pretty much is going to be an issue derabanan. When we say all carrying, we really mean it's very hard to figure out a deraisa case of carrying, mostly because a Rishis Rabban has very specific legal requirements, and it's very hard to find a Rishis Rabban in 21st century, life. So practically, this is going to be an issue derabanan. And our question is this migraine enough of a justification to violate an issue derabanan? And is there any specific way I need to violate an issue derabanan if I was going to try to get medication to this patient?
So approaching the second case, let's see. So your grandmother needs a refill on her rheumatoid arthritis medication. Without her treatment, she is in severe pain and has a hard time being mobile. So just right off the bat, that already makes it a lot clearer that this can refer to a patient that we were discussing before, that a chol shein was kind of sort of like in a really bad position, and then they could even be immobilized. They have to lay down. I think in Shmir Shabbos, he mentions that refuah, he talks about patients that refuah can be an issue, giving someone medication. But I think he mentions that if they're in this type of situation, the way it's described here, where they're immobile and have to go lay down, that refuah is also not an issue on Shabbos. So it's not something we mentioned in the first case, but it seems like in this case, for sure, it's not a problem. And then, are you allowed to go to Walgreens, get a refill, and pay the copay on Shabbos? Okay, so this is a little bit more complicated. From my understanding, you're still going to run into the issue of carrying, just because you're going to be going to the store, not the store. You have the issue of money. So depending, I think at first, when I first heard this case, I assumed that selling and buying on Shabbos was deraisa. I no longer think that's the case, but at least at first glance, thinking of going into a store on Shabbos is just so wild that you assume it has to be deraisa. At least that's what my thoughts were. You also have the issue, this is kind of a smaller one, but when you go to the store, at least I know that when I've walked in Flatbush, sometimes you walk next to the store and accidentally the electric door is just open. So that could be an issue, but that would also, that is derabanan. We know electronics for the most part are derabanan. So those are the issues I'm seeing. I'm seeing the carrying, I'm seeing the money, I'm seeing certain electronic issues going to the store, and and then refuah could technically be an issue, but we know that based on this situation that that wouldn't be.
So yeah, I'm glad you bring out that bit about refuah on Shabbos. So refuah on Shabbos, doing a medical action on Shabbos is considered an Issur Rabbanan. And the reason why I didn't really bring it up, because being that the whole thing is Issur Rabbanan, we said that Makom Chayil Gaz Rabbanan, that really doesn't ever come up to be an issue in this class of cases. In the class under this, that's to say something that's much more minor, like a headache, a minor headache that you can still push through, a minor cough you can still push through, a slight sinusitis, that becomes an issue. But again, that's beyond the scope kind of what's relevant to future clinicians. Obviously, it's relevant for individual citizens, so to speak. And we are also, we also have to keep Shabbos regardless in our private lives. But that being said, it's beyond it's not really a medical halacha question, more of a regular halacha question that should be, spoken over with your local Orthodox rabbi. And I say that because there's different people pass in different ways about what class of things you're allowed to do, and are you allowed to continue medication? Are you allowed to start a medication on Shabbos? And there's a gamut of acceptable opinions, and didn't really want to get into that. But yeah, so here we have the shiloh, firstly, of carrying that we're going to have to address in the previous one. We said practically it's going to be a derabanan. Unless you know for sure that there's a derisive rabban, which again in the 21st century is hard to come across. Going into Walgreens, so you do have the issue of the electric doors. You can try to get around that. You can try to walk in at the same time with someone who's not Jewish. So it's not you that's activating it. But like we said, electricity in general, especially according to Rishon Zalman, even though it is a contentious issue, it generally is erring on the side of being a derabanan. And then getting a refill by paying with copay, right? So either you're going to end up paying with cash, or you're going to end up paying with a credit card. So you're going to also have to carry the funds, and not only going to have to carry the funds, you're going to have to get someone to engage the electricity. Again, we said that's a derabanan, but is mekach memker a derais derabanan? Like Mark said, it is in fact a derabanan. It was a gzera of Ezra Nehemiah, so it's probably one of the earliest, gzeras derabanan that we kind of have on the books. But it is technically a derabanan.
So I just want to point out one thing for anyone who's seen our previous lectures, and we talked about the categories of a sick person. And then when we said a cholash yesh bo sakana, we really said oh, this is someone who's in danger and you're really allowed to do a lot for them. And then we said cholash ein bo sakana, someone who's not in danger. But that's kind of a big, just because we touched on the idea of refuah and how that for cases that would be not as bad as this one, where someone isn't totally immobile or bedridden, those are not really what we're talking about when we say she'im bo sakana. So just because you're not in danger doesn't make you into this category of refuah is totally fine and derabanans are totally fine. But within our conversation, we're talking about the specific type of she'im bo sakana where they really are sick. It's just she'im bo sakana. Is that?
Yeah. No, that's a really important caveat, and I really hope that the first few cases, especially that in the slide you can see the case from the written word of Rav Newborg from Shmir Shavskal. So he does a really good way of defining that. But yeah, most slight headache, slight issues are not considered chayshim besakana. Those have a different classification in halacha. They're called michush ba'alma, which is a slight annoyance, right? A slight grievance, and that's not the topic of today's conversation. All right. So we basically just defined our terms. We defined our terms, and we did a little bit of a practice run through, trying to take the anatomy of different cases and break it apart to figure out what our question is. And that's really the lion's share of the difficulty when approaching Shabbos questions. Obviously, this needs to be done under the tutelage of a Rav, which this is not in lieu of that. But it is helpful to understand the process. So when a person does ask this question to a rabbi, a competent rabbi in these matters, they understand how to present it and understand what questions the rabbi is trying to get at. So our first, as we try to go chronologically between the sources. The first time you really see this set of conversations is going to be in Shas. Obviously, the Mishnah doesn't really talk about it as much, but you really get into this case law when you're talking about it from the Gemara and on. So our first case from the Gemara is going to be from Ksubas Daf Samach Amud Aleph, and just a word on the case. So the case is going to be called Hageneach Mikevlev, someone that's really coughing because of a heart issue. It looks like this is describing some sort of a viral illness. And the remedy for that viral illness before the advent of modern antivirals was goat milk, that or some other sort of bovine milk. And they recognize that if you drank very, very fresh goat milk or bovine milk, that it would lessen the symptoms and severity of of the symptoms that you'd be having. And this is, funnily enough, actually backed up by modern basic science. This is a study done from, I think it was Tel Aviv University. They just studied, and a study that came out in Clinical Nutrition. It came out in June 2021 about the antiviral properties of goat milk. So potentially, if you're talking about a heart issue and a virus, maybe one of the Coxsackies, the Gemara didn't really get into it, and the Gemara definitely didn't have sketchy. So I don't know how the Chacham could have remembered that. But Tanya, Rabbi Mornis Eimer, Geneach Yenik Chalav b'Shabbos. Someone who has a status of Geneach. Geneach means they're having a terrible cough or a terrible issue. He's allowed to suckle from a goat on Shabbos. Why is he allowed to? The Gemara explains, because you're taking milk out of this animal in a non-normative way, and as we explained in a previous lecture, melachos on Shabbos are only asur. Work on Shabbos is only asur if it's done in a normative way. And being that you're extracting milk in a non-normative way, what was once a isur deraisa is now only an isur derabanan. And in the words of the Gemara, of Makom Sara loy gazer rabbanan. The Chachamim never made a rabbinic enactment against doing things on Shabbos. In the case of tsar, in the case of pain, Rav Yosef says halacha Rabbi Mirius. The halacha is like this opinion in the Gemara. Okay, so that's our first case. Our first case basically limits as long as it's derabanan, it's done with a shinui. From what it looks like in this case, it would be allowed. There's another case that's brought down in Shas. And there's really 3 or 4 or 5 Gemaras that really keep coming up in the literature. They're hard to go through, and there's a big argument amongst the primary and even secondary sources. That being said, these are kind of the 2 clear Gemaras. And our first one said you're allowed to do Darabanan. This one's going to take a little bit of a different angle. So a Maimar was he lived in Babylon. One of the more influential Amoraim, lived in kind of the first few generations of Amoraim. So he had a terrible eye pain on Shabbos. And what they used to do is they put some sort of a colored salve on the eye. Now, the issue with that was that it was tzivea, coloring the eye, similar to makeup, is asur on Shabbos because you're not allowed to color things. And that's an issur deraisa. That's a biblical prohibition. So what he did was he asked a guy, someone who isn't bound to the laws of Shabbos, he asked a Gentile to put it on his eye on Shabbos. This is followed up by a little statement. Rav Nuna says, anything that is not of critical nature on Shabbos, you can ask a guy to do it. So 2 classes two kind of directions to permit these actions on Shabbos. One is to make sure it's a derabanan, and 2 to make sure that someone who's not bound by Shabbos is the one doing them. This is from Gemara Beitza Daf Chav Beis Amud Aleph. All right. Now these cases seem clear cut, as we're going to see. In the analysis of the Rishonim, the Rishonim have an incredible difficulty with this, and we see 2 real opinions that are going to come up in practical halacha. In truth, there are probably close to a dozen opinions, but these 2 are going to be voiced very prominently in the Shulchan Aruch, and they're going to make its way down to contemporary Pesach. So we're going to spend a moment on it. So the first is the Ramban. The Ramban lived born right before the 12th century. He passed away almost in the 13th century. Extremely influential in terms of the Sephardic Rishonim. Everyone really from the Sephardic Rishonim on are experiencing their opinions, and they're making their opinions in context of the Ramban. And being that a lot of our halachic literature is really Sephardic literature, Chaber, Rashba, Rush, Rif, this really does takes a big chunk of the conversation. So he looks at this case and he says, really, what's happening in this case is, and just to read the underline, what is allowed in this case of a chayil she'ein bo sakana Shabbos, and again he defines it as person who is bedridden. You're allowed to do a mlacha if it's done with a shinui. Now, I read through it really quickly and I mumbled over it because the exact reading of what he says is going to be a big point of contention amongst the achronim. So there's 2 ways to read it. One way to read it is you're allowed to do a derabanan with a shinui. That's to say you're allowed to do something that's rabbinically prohibited, but you still need to do it in a non-normative way. Another way to read it is that you're allowed to do a biblical isser in a non-normative way, which again is derabanan. Now, those are going to be 2 very, very different angles, and that's going to allow us to do things in very, very different ways. And obviously, the second way, doing a deraisa with a shinui, is going to be much more permissive. And we're going to get back to that. But again, there's a bit of ambiguity in this Ramban, but all we know from this Ramban is you have to do the action in a non-normative way. So the Rashba argues with them.
Just like to, based on, I don't know how many people follow our lectures or have watched previous, but we've discussed in the past just a basic concept that when you do something deraisa and you do it in a non-normative way, right? We know that as a shinoi, for example, using your pinkies instead of your hands to do certain things, that immediately makes it a derabanan, right? And then there are things that are just inherently derabanan because they're not stated that deraisa that these are issues. So we know electronics are to begin with an issue derabanan, and so doing a shinoi, doing something in its non-normative way for a derabanan is derabanan like once removed. Whereas doing a deraisa with a shinoi is a derabanan. And so that our question becomes, or what we're trying to get at really, is that we know that someone who's sick but not in danger, which is where all our conversation of this lecture is taking place, do they have to do a derabanan in the sense that that's just a deraisa in a non-normative way, or do they have to do a derabanan and then on top of that do it in a non-normative way? That's where we're getting at.
That is where we're getting at. And you're gonna ask, wait a second, didn't the original source, the Gemara in the Gemara in Ksubah say b'makim tsar legaz rabbanan? And that's really what the next opinion is going to opine. So why does the Ramban, take this, like Mark said, that you're going to have to do a derabanan once removed, right? What's the legal philosophy that we're going to try to address that in a later source. But again, that was a big part of why this Ramban was such a hard read. The Rashba lived in the generation exactly after the Ramban. He was actually, in the literature, he's considered a Talmud of the Ramban. He lived in the same area, Barcelona, Catalonia, Aragon. So they had great culture, and they also had great weather. So their quality of life, just anecdotally, was and completely off on a tangent, was a lot better than your average Ashkenazic Christian. So he says there, this is actually a beautiful tshuva. You can read it on the inside, and it's written in something that's very close to modern Hebrew, so it's honestly a pleasure to read. So he says, what are you allowed to do? You're a yid's allowed to do a derabanan even through a Yisrael. So that's to say, he goes against what his teacher the Ramban said. He says that a derabanan doesn't need to be done with a shonei. A derabanan can be done straight. You don't need to do a derabanan once removed. You can do a derabanan straight. And again, voicing what our Gemara said before, b'makim tsar legas rabbanan. So again, just to reiterate this, because it's going to come up from now again, there's only two opinions that really matter when it comes to this. There's the Rashba, who says the derabanan is fine without a shinoi, and then there's his teacher, the Ramban, that says a shinoi must be used even with a derabanan. And again, we said that there's a bit of ambiguity in the Ramban that we're going to kind of explore right now. So when this is brought down to the Shulchan Aruch brings down 4 opinions regarding what you're allowed to do for Chilul Shem B'Sakan on Shabbos. Now, this is very uncharacteristic of the Shulchan Aruch. The Shulchan Aruch usually brings one opinion, the Rama usually argues with another opinion, and that's generally how things go. When he brings 4 opinions, that really shows that in his time, in his generation, there wasn't a clear consensus, and that any one of these 4 opinions were considered within the realm of what was acceptable. That being said, he did have a personal favorite, and he says, "V'difrei hasvara shlishus niran." He says the third opinion that I quote, which happens to be the opinion of the Ramban, is what he follows. So here we see that there's that you can kind of use any one of these 4 opinions, as we're gonna see in later authorities. That being said, we give precedence to the third opinion. So if you can keep the third opinion, that's considered de facto the opinion of the Ramban. That's considered the best case scenario. All right. So in defining what the Ramban's opinion is, again, can you do a derabanan, and does there only a derabanan? Is only a derabanan allowed with a shinoi, or are you allowed to do any deraisa as long as with a shinoi? That's to say, the action itself needs to be a shinoi. Is a matter of intense argument, and we're going to bring 2 people that kind of argue this point. That being said, that there's many more people on both sides of this argument. So start chronologically with the Shulchan Aruch Harav, with the Alter Rebbe. He says he reads the Ramban a little bit more literally. He says, based on our case, Geneach Mikev Lev, a person's allowed to suckle from a goat. That itself would be a Issa Deraisa. The Issa Deraisa, though, as long as it's done with a shinoi, is allowed. So, in other words, you're allowed to do Deraisa with a shinoi. That's the way he reads the Ramban. So he follows the third opinion of the Mechaber, of the Yosef Karo. He just reads it in kind of a more perhaps traditional way. The Mishnah Berurah argues, and he says no. He brings a few different opinions. He says the third opinion is the one we take. That being said, the third opinion only allows us to do a derabanan with a shinoi. In other words, like Mark said, to do a derabanan once removed. So the Alter Rebbe is saying you're allowed to do deraisa once removed, and the Mishnah Berurah is saying you're only allowed to do a derabanan once removed. Now, I bring it as a conversation between the Shulchan Aruch Harav and the Mishnah Berurah. In truth, siding with the Shulchan Aruch Harav was Tila David, Eglei Tal, Ketzas Shulchan. These are figures that span more than just the Chassidic world, and more than just the literature world, and more than just the Sephardic world. So you really do have a lot of people, no matter which walk of life you come from, to follow this more permissive opinion. That being said, for those that are very much have a lot of fealty towards the Mishnah Berurah, it is really worth recognizing that he does take a more machmir opinion. Now,
maybe you can just, sorry, if you could go back one slide. First off, maybe you can just orient us to the pictures on the screen.
So I think everyone can see the Chavetz Chaim here, right? This is Mishnah Berurah and all his glory. This is probably the most well-known picture of him. This is a lesser-known picture. This picture was if anyone knows Crown Heights well, it's on the corner of Carroll and Kingston, and you gotta love Crown Heights for its own really unique version and brand of graffiti. So it's right across the Kalim Mikvah. So if anyone's going to use the Kalim Mikvah on Kingston, that's right at the corner of Totally Her, you're going to see this beautiful picture of the Alter Rebbe. I don't know if this is really approved by the real Hasidic scholars. I like it though.
And just to clarify, based on what we're walking away with, I mean, we have major opinions, not just Alter Rebbe, but major heavy hitters who are saying that you really can't do a deraisa with a shinoi, and that's a derabanan, and you could read that into the Ramban, correct? And so that you could, obviously from this lecture you can't walk away with that, but when you approach a Rav, a lot of them can rely on that, regardless of sect of Judaism, regardless of being Lubavitch or being Ashkenazic or Sephardi. In terms of, if you did want to be a little bit more machmir and go and then whoever you were asked in a whole like the Mishnah Berurah, that would ultimately exclude you from doing things that are deraisa with a shinoi, meaning it's only permissive if it's already a derabanan and you're doing it with a shinoi. So a direct derabanan, like regular electronics of the day, would actually really not be okay.
Yeah, and potentially that might also be an issue. There are opinions that are more stringent saying that electricity is deraisa. And in that case, you really would be put in a bit of a bind. Meaning if you happen to hold both of those chumras, that could be a little bit more difficult. That being said, most Rabbanim will be a little bit more permissive, recognizing that when someone's in severe pain, it might not be the most appropriate time to really figure out every chumra that you can use. Still, we're left with a bit of a question. According to the way the Shulchan Aruch Rav and a lot of the other Gedolim read the Ramban, it seems like there's a bit of a lack of synchronicity, so to speak. It seems like a little bit of an odd matchup. It says that you're allowed to do a derabanan, but the derabanan itself needs to be done with a shinoi, and you're allowed to do deraisa with a shinoi. So wait a second. If you're allowed to do a one step off, kind of a derabanan, a straight derabanan, why would you need to do a derabanan with a shinoi? And the Ksesar Shulchan really looks at this logic. Ksesar Shulchan was a rabbi lived in Eretz Yisrael. Right, he was alive during the times of the Mishnah Berurah, but he lived really kind of right. He wrote his sefer right after, and you can see the Mishnah Berurah quote a lot. And he says the logic is that makam tzara legaz rabbanan. Whenever there's a moment of pain, the Chacham said, we're not making a gzera to impede what you do. We don't want you to be in pain. That being said, what we are afraid of is that this becomes normative for you. What we are afraid of is that your action will become a habit. And so, though we don't want to make a gzera in your case, we want to make sure that you're doing it in a way that's not going to become habituated. So we don't want you to become habituated to using this heter. So therefore, we're going to demand you even do a derabanan with a shinoi, because being that doing it with a shinoi is inconvenient. In your mind, you'll never become habituated to doing this action. So it's almost the derabanan, even a derabanan, needs to be done with a shinoi, so that later on, the gzera is really applying to later on. You don't have this habit of being over an derabanan, and so therefore, it doesn't matter if it's a dress, it doesn't matter if it's derabanan, as long as it's being done with a shinoi. A, you're not going to become habituated, and two, it's just a derabanan, so you have that heter. Now, there are certain cases it's just not going to be possible to use a shinoi. One possible case is if you're trying to get a rectal temp on a baby, right? It's very hard to use a shinoi, and I would argue maybe you shouldn't use a shinoi in that case. If you're trying to, get the thermometer where the sun's shining with your elbows, that might not be the right time to use a shinoi. And in that case, it's really helpful to look back at our Shulchan Aruch. Our Shulchan Aruch brings four different opinions. The first opinion that it brings is actually that of the Rashba, that a derabanan can be done without a shinoi. So where it isn't possible to use a shinoi, there are other cases that you can kind of be creative about. In those cases, you don't use a shinoi, and this is you follow the opinion of the Rashba saying that any derabanan can be done as long as it's derabanan, it can be done even without a shinoi. The Mishnah Berurah quotes this, the Ramesh Feinstein quotes this, and the Chai Adam quotes this, all saying that you're allowed to rely on the opinion of the Rashba in a place that you don't have another choice. All right. Now the Nishram Savram, who again is a Talmud of the Rishon Zalman Auerbach, he goes back to our conversation that we had right before. So we had our conversation before. We presented it as an issue between the Alter Rebbe and the Mishnah Berurah, whether or not you need to do can do it the rest of the Shonei. And he quotes Rishon Zalman Auerbach and he says, "The Mekaven to call El Hagdel Matir." Since all these original people, and he quotes the Tila David, Eglei Tal, Shulchan, and the Shulchan Acharav, since they are all matir in a case of a deraisa done with the Shonei. He says, first, you're going to try to ask a guy to do it. But if you can't ask a guy to do the action, you're definitely allowed to follow their opinion. And so in a case where someone's in pain, Nishmas Avram, Shlomo Zalman Auerbach, and kind of everyone, the Shmir Shabbos Gilchasa, they all quote this idea that you can be makel and do a deraisa with a shonei.
So, I mean, before we return to our original cases, if you have to do a deraisa with a shinoi, but it's an act that can't be done with the shinoi,
you're not allowed to do it.
They're not allowed to do it. That's only derabanan with the shinoi, but you can't do the shinoi, so it's fine. Don't do the shinoi.
Yeah. So going back to our opinion, the Rashba said that you're allowed to do any derabanan. Again, quoting our Gemara in his trivia quotes our Gemara, Makom Tzar Legos Rabbanan. The Ramban is more finicky, and he says that you can do the Rabbanan as long as it's done with a shinoi. And depending on how you read the Ramban, he kind of makes it sound like you can do any action as long as it's done with a shinoi. And the psychology that we said of the Ramban, legal philosophy of the Ramban, quoted vis-a-vis the Ketzos Shulchan, he said it's because we're really afraid that you'll get habituated to doing this. And so later on, our gzera, so to speak, is that you do it in a way that later on you won't end up doing it, which is kind of I thought it was really insightful, because when you're reading it, it seems like this odd mismatch of legal philosophy. It's like, why? And he finally really puts it black and white, which is really beautiful to see. All right, so now we're going to go back to our original vignettes, and we're going to analyze it with information that we've had before. So your spouse has a migraine, or community member has a migraine. There's no Motrin. You want to get Motrin from a neighbor, or you want to get some medication from your doctor bag, and you carry it in the back of your hands. Is this allowed or not allowed?
So it's funny. I think when I originally approached this case, I didn't even discuss the back of your hands, but I assume that was put in there as like you're doing it as a shinoi, right?
Yeah, and I actually want to take this as a jumping off point to describe a few other ways that it's described to be able to carry something. So if you're unable to carry it in a non-normative way, back of your hands is literally just a direct translation from the Gemara, kalach hayad, which is really the way the Mishnah describes it. Another way that the Shmir Shabbos Gilchos writes that if you're wearing a hat on Shabbos, you put it under your hat and use the hat kind of as a you basically carry it with your head. Another way to do it is to carry it under your arm, kind of like a book you would carry kind of under your arm. A bunch of different ways to do it, and that would make all of this kind of a derabanan, even in a case, by the way, where there's a deraisa shrabim, potentially on however you pass it. So in those cases, you'd be allowed, right? Because again, we're dealing with a migraine. Migraine is chayeshem besakana. This person's bedridden. You're doing a derabanan, and either it's a derabanan done with a shinei, right? Like we described before. Even the Ramban says that's allowed, or it's a straight derabanan, and that the Rashba allows. So in that case, you definitely have both of these venues of heter to rely on. So that would be allowed. Okay, so now this next case is definitely a more engaging case. So in this case, we had a little bit of a difficulty breaking apart. So her treatment, your grandmother has rheumatoid arthritis. You need to get her medication. She doesn't have medication. You basically go get a refill at your local pharmacy. Are you allowed to go? We're assuming there's no Erev, but even if there wasn't Erev, you're gonna have to go. You're gonna have to go into the Walgreens. You're gonna have to request it. You're gonna have to get a copay. You're gonna have to use a computer and potentially sign for it using an electronic chart. Is this allowed or not allowed? So, and we broke it apart, and I think, Mark, how did you break it apart last time?
Okay, so just I think we did a good job of going step by step of what you would need to do. So the first thing was leaving the house, and you're gonna have to carry whatever money that you have to go in order to pay the copay. So we had the issue of carrying. We also had the issue of like if you're not allowed to do selling on and buying on Shabbos, then the money itself can, I didn't speak that out, but the money itself can become muktzah depending if that would be a deraisa. But so just with those, the carrying, we said really it's unlikely that it's a Rosh Hashanah. So it's likely that this in general, without changing anything, is only a derabanan. So then you would be like okay to do that. I mean, ideally there should you should generally be finding a way to do it with a shinoi, but I'm not sure that carrying money, I guess carrying a credit card, like you said, maybe if you have a hat and you do it with a shinoi, then you're really fine. And then we said, so then we actually clarified that selling and buying things on Shabbos is not daraisa. So there you go, darabanan again. I don't know that you'd be able to pay with something darabanan, but that may fall into the category of like a time where a shinoi can't be done. But since it's darabanan, we cleared that. We also mentioned going in, opening the electronic doors. We knew that was darabanan right away. Again, not something you'd really be able to do with the shinoi. So, I mean, I don't know. It seems like the shinoi conversation is a little more complicated. So I think that's something that really goes beyond the scope of what we're discussing, but it should be discussed with a Rav. But if you really can't do a shinoi and it's derabanan, you're good with that as well. And then the payment, same thing. You're using electronics, you're doing the payment. Those are all derabanan. So if you can do a shinoi, you're really clear because it's derabanan and a shinoi, and this patient is a chol she'ein bo sakana because they're sick enough, then this would all really be allowed. And then it's funny to say it out loud because when I first saw this case, I was sure there's no way, absolutely no way, if my grandmother came to my apartment for Shabbos and said that she needed medication from a pharmacy, that I would think for a second to go to the pharmacy and buy her medication. So it's pretty amazing.
And honestly, all these cases I kind of got from Shmuel Shabbos Kelchasa, and I cleared it with a Talmud of Hashem Zalman Arbach at the same time, who helped compile the Sefer. And I did that because it was, again, it was also really, it was non-intuitive. How so many, like I understood the words on the page and I understood that the Paskim are saying that. I just like, really? I've never seen that done. All right, and here's another outlandish case that I found, not outlandish, another case that just felt very odd in Shmir Shabbos Chilchasa. So the case was, someone gives you a call on Shabbos. I'm not critical, but I'm in pain. Are you allowed to take a taxi to them as a medical professional and just check them out? Right? You're in the assumption you don't even know if they're a chayil she'ein bo sakana or yesh bo sakana. So he says you're allowed to go, you're allowed to come back. His only issue is, how are you going to pay the taxi driver? So he says, because what he's worried about is you're not going to be able to take the change back. So honestly, this is kind of an interesting case. It's worth reading, and it's really worth reading the whole chapter in Shabbos Kelchasa. And you can find the sources all on the PowerPoint.